Even the ability, because we are supposed to be in an environment where we can negotiate. We're supposed to be in an environment where even a member with the expertise on the Public Health Committee should be able to convey why this is so important. And you know, we all are involved in the hustle and bustle of trying to pass amendments, and I understand that we all are equally frustrated with certain things. But I have to tell you, I'm not a first-generation immigrant daughter who grew up on a working farm in Massachusetts, who has just as much knowledge and skill and really compassion in this area, not to offer it up. I was sent by the people of the 18th Worcester District, a district which in a few minutes I'll explain even further why this is so important to me. Because it isn't just my district, but my district in particular has been hit very hard. And very hard to me to be able to ask the questions, why do we have such an increase in the number of children who are at their end of life, who have had extremely debilitating circumstances? And so to the gentleman from Walden, I'd like to explain a few more things of what this actual Pediatric Palliative Care Network would do. And if we could fund it just a few more dollars, what it could mean to somebody in your district. I have examples from the North Shore. I have examples from Cape Cod. I rely on the people in those particular districts to try to educate me about something that's important in their district. And I know that we have an overwhelming amount of information to digest in a short period of time. And I have so often looked to the leaders in each one of these committees to try to educate me. But I also grew up in a family in which my father fled his country to come to this country to talk about these issues. He fled a country under political oppression to make sure that you question authority, and whenever you can, you help somebody. After all, my father is just somebody who's in the phases of palliative care himself right now. And you might be asking yourself, maybe I'm a little overly sensitive about the subject, because perhaps I see somebody in the waning phases of their life, and maybe I can't do something about that right now, but I can tell you that each one of us have the ability to understand what this is about. We're talking about hospice care. Hospice care in an environment that is most conducive to those people who are most in need. You know, they say that a child's life is like a piece of paper in which every passerby leaves an indelible mark. I don't know about you, but I think we all feel that real responsibility to answer how important that is to each and every one of us in our lives. And perhaps children who are sick in the final phases of their life, who would depend on this earmark. But it's not an earmark for my particular district. It's a line item. It's a line item that is proven to be so successful that is growing at a clip that isn't not necessarily sustainable. It makes more sense than ever to be doing this. And yet, you can't get people in a room to understand that perhaps maybe if you were heard on the issue a little bit more, you'd have an opportunity to express this and perhaps to convince somebody of how important this is. The services provided by the Pediatric Palliative Care Network include everything from the consultation related to pain management, to consultation in actual management of clinical symptoms. That's what we're talking about, kids who are really expensive kids to take care of, but they are no longer appropriately set in an environment like a hospital. Yet if we don't provide these services, that is where they will die, and that is where their families who so long to yearn to coordinate care in an environment that is most compassionate and most appropriate, don't have access to those services. And when I tell you about the cost savings and the comparability, you'll say, why are we not in a Committee on Ways and Means listening to such things? Because it makes sense. The service is beyond symptom management. And so for a child with cancer, you can imagine what that means. Maybe it means blood transfusions. Maybe it means IV drips. Maybe it means something more beyond injections for pain management. Maybe it means gastric tube feedings. Whatever those symptoms may be, this Pediatric Palliative Care Network, in which a family which qualifies can enter into, it provides them with that. So now, the services that we're talking about, beyond that, beyond something that a hospital may not be able to offer, involves the social service aspect. involves the spiritual care of the child, involves the counseling and the volunteer support that's needed at the bedside, not in a hospital, but in the actual environment of choice for the parents and the child. And you might be thinking, kids don't really care where they're going to die. I can tell you right now, most kids have more guts and courage than any one of us in this room, especially when they're at their final phases in life. This particular network provides respite care. And for those of you who have not been at the bedside with a loved child, who you have placed all hope for a cure, and you have endured hospitalization after hospitalization after hospitalization, and you realize when you have that final conversation with a physician that the child is not going to get better. Why don't we see how important that is to a family? Why do we have to wait to understand how that is measurable to someone? This program is so important to so many of us, and you will recognize that when you actually hear more of the details in a follow-up letter from me. One of the things I want to remind each and every one of you is that listening is really important. It's as important to a child who is crying out to go to a place in which they are no longer suffering and no longer have a burden. And nothing is as strong as gentleness, and nothing is as gentle as real strength. We were all sent here to give hope to people. And I believe oftentimes that hope abides in all of us, and it whispers in people's ears, especially those little ones. And I want to say that today, having been able to get up here and be prepared to talk at length on this issue, I do believe I was heard. I not only believe I was heard, but I do believe each one of us is going to make a magnificent difference in the lives of children who are at their final phases. And I want to thank the Speaker. I want to thank the Chairman of Ways and Means. I want to thank my Chairman of Public Health. I'd like to thank the Chairman from Malden. I'd like to thank each and every one of you for listening for the amount of time that you did, because I was prepared to talk an awful lot longer. And for that, I am deeply humbled and respectful of your time and your energy and your thoughtfulness on this issue. And I will be prepared to make sure that each and every one of you, when you go home to your districts, you will be prepared to explain something that is truly a worthy and beautiful program that's not only cost efficient financially, socially, it bars none for cost because our moral compass is pointed in the right direction. And human cost, we have allowed families to be with their children and to die with dignity. And that is something none of us can place a dollar figure on today.